So the size and the placement and the instructions for your patient are all going to be very conceptual and dependent on what your provider is asking of you and what the actual wound is. Sometimes they will have sutures, sometimes they will not. They'll have steri-strips. Sometimes they don't need a wet to dry dressing. There are all kinds of different types of dressings and wound care out there. These are some of the basic ones that you will then add to as you go into your practices. We are going to mock that this patient is coming in for a mole removal. Okay. So, first thing I'm going to do is I'm going to introduce myself. My name is Becky. I'll be your medical assistant today. Can you verify your name and date of birth? Okay. Do you have any allergies to iodine or betadine or seafood, shellfish, anything like that? Okay. And we are removing a mole today, is that correct?
Correct.
All right. I'm going to have you go ahead and sign my consent form for me. This is just telling us that you agree to have this done and you know what's happening. Perfect. All right. So the first thing I'm going to do before I touch my patient is I'm going to hand sanitize. Okay. I am going to clean my area, okay? So I'm going to open these swabs. These are alcohol-based swabs, and I am going to take one, and I'm going to start from the center of this mole, and I'm going to work my way out, moving any bacteria to the outside, okay? Throw that away. I'm going to do this 3 times. Okay, so now her area is clean and ready for me to drape with a sterile drape. Okay, this drape is going to cover all of the area around where the provider is going to work. Okay, it's called a fenestrated drape. Fenestrated drape means it has a hole in the center. I want to only touch the corners because if I touch everything else, it's going to compromise its sterility, right? Okay, so I'm going to pull it out just like this. I'm not going to touch it. I'm going to drape my patient. And now her wound is open. The provider's going to come in, do their procedure. Okay? Provider comes in, does their procedure, then they're going to have you come back in, clean up the wound, put a dressing on it, give the patient instructions, and send them home. Okay? So I'm going to come back into the room. All right, Miss, how did things go? Good? Good. All right. So envision that there's blood, all kinds of stuff everywhere. So I don't want to touch that without gloves on, right? So I'm going to go ahead and gather this. This is all bloody and gross, so it's going to go into our biohazard, right? All right. Now, there's blood everywhere. I want to clean that up. So, in order to do that, I want to use a sterile basin that's been through the autoclave. So, in order for that to remain sterile, I can't touch it, right? Okay. Now, I'm going to pour some sterile water into my sterile basin for me to use to clean that wound, right? So remember, I'm using aseptic technique. I'm keeping all pathogens away from her as best as I can, right? So I'm going to take a look at my sterile water, make sure it's not expired. I'm going to remove the lid. I'm going to pour out just a little bit and rinse that lip. And then I'm going to hold it above my sterile basin. And now I'm going to use sterile gauze to clean her off. Once again, I'm going to open this and it's sterile. So I don't want to be putting my hand all over it, right? So I'm going to actually go like this and pinch it like that so that the sterile side is going to be on my patient and I'm only touching the back side. I'm going to go ahead and dip it in my water. Once again, I'm going to start in the center and I'm going to clean towards the outside, moving away that bacteria. So she is all cleaned up. I'm going to remove my dirty gloves because I now want to put on a nice sterile dressing on her, okay? My provider has asked that I apply some antibiotic ointment to her wound prior to putting on her dressing. So I'm going to open my sterile tipped applicator. And my antibiotic ointment. I'm going to gently apply the ointment to her wound. And then I'm going to take a non-adherent bandage. And it's sterile, right? So once again, I don't want to touch the whole thing. I only want to touch the outside piece that's not going to be touching her. Place that on her, just like that. I'm going to tape it down if I can get my tape open. There we go. All right, so just like this. And now it's still oozing a little bit, so I'm going to want to apply a reverse spiral bandage to her to send her home, okay? So I'm going to have you lift your arm up for me, just this. Just like we learned yesterday, we do a base, like this. All right, and I'm going to do my 2 checks, right? How's that feel? That's good? Okay. All right, so you're going to go home, you're going to keep it dry, clean, don't take your bandage or your dressing off. We're going to see you in 2 days, okay? All right, so now we send our patient on their way. All right. All right, and she is going to come back. We'll have a nice clean room. All right. All right. Hi, Miss. How are you? My name is Becky. Can you verify your name and date of birth for me? All right. How's your wound feeling?
That's good.
All right. Let's go ahead and take that bandage and dressing off and take a look at it. So I'm going to want to take a look at it, and I need to remove this. I'm not going to just rip it off. Okay, I'm going to start by gently removing one piece of tape, keeping in mind that if patients have hair on their arm, it might tear. So be gentle. Okay, now she's got a wound under here that's healing, so it could very well be stuck to this dressing, and so I'm going to start to gently pull up on it. When I notice that it starts to stick a little bit, one of the things that you can do is you're going to use that sterile water. Remember, you open it, pour out a little bit, and I'm just going to gently pour some water onto that and let it soak so that I'm not ripping open any of that healing area. Okay, so we soaked it. We're going to pull this back. All right, and now what you want to do is you want to take a look at your wound, and you're going to document how it looks. Okay, you want to look at it, see if it's red, is it swollen, does it feel hot to the touch, any of those things that you would see if there was potentially an infection going on, or if it's healing really nicely, because you're going to document how and what you see once you take that dressing off. Okay, so it looks pretty good, it's healing. The provider has asked that I put on a wet to dry dressing to help with the healing phase. So I'm going to put new gloves on because these are all dirty from touching all of those outside things, right? And this time, we're going to go ahead and clean it up. So our sterile water again into our new sterile basin. Once again, I only want to touch one side of this gauze. We're going to go ahead and clean, gently getting off any of the dried drainage or anything like that, right? All right, a wet to dry dressing is going to require us to have a sterile 2x2, which is this, okay? And it needs to be wet. A sterile wet to dry dressing is used for mainly to reduce scarring. It is used a lot on burns and those kinds of things. So I have my sterile 2x2. I have my sterile water. I'm going to go ahead and pour that on there. Now, when you think about this being a porous substance, I don't want to touch any of it, right? Like I had been doing. So I'm going to go ahead and just touch the corner. I'm going to apply my sterile wet dressing, and then I need to protect it, right? So I'm going to use what's called a tegaderm bandage. Set it right like this. Gently pressing it down so it sticks to the skin, and then you're going to go ahead and peel away the edge, gently pushing down on that edge as you go. So it seals in the wet dressing and protects it from the outside. She can then go home, she can shower, anything that she needs to do, because that tegaderm will protect the wound. Okay? And then you're done, you send them on their way.